to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today, we're talking about an illness that affects millions, yet is still frequently misunderstood: Lyme disease and other tick-borne illnesses. So our guest today knows this journey very intimately. We're so honored to welcome Maria Malaguti, founder and executive director of the Lyme Disease Resource Center, a peer-guided nonprofit supporting individuals and families that live with Lyme disease. Maria's work is deeply rooted in lived experience, advocacy, and community building. Thank you so much for joining me, Maria. How are you doing?
Thank you so much for inviting me. This is such an important topic.
Yes, I agree.
I'm glad to be here today.
Oh, wonderful, wonderful. So where are you joining us from? What state are you in?
I'm based in Northampton, Massachusetts, and
Gotcha.
that's
Okay.
where our organization was founded.
Okay, I love it. I love it. So why don't we kind of start from the beginning? So your work began with your own health journey. Can you share what happened after you were bitten by a tick, how that experience shaped your path, and maybe add to, like, did you know right away? Because I know as a provider myself, a lot of times when patients test positive for Lyme disease, they don't always know, when they were infected and things like that. So,
I was always an outdoors person, horseback riding, skiing, gardening, and I believe I was bitten multiple times over the years, but my immune system protected me. In 1997, I was backpacking in New Hampshire, and I apparently was bitten. I thought it was a spider bite. Soon after, I got sick with what I thought was the flu, and my health declined over the next year, but I didn't seek medical help till apparently I had a series of small strokes and ended up in the ER. And when I started looking at the chart and checking off all the symptoms, I had multiple odd symptoms that I hadn't even thought about. The doctor dismissed me at that point in time.
sorry to
Um,
hear that.
and it was another several months before I was properly diagnosed.
Were you given a different diagnosis, like, oh, it must be just like in your head, or it's something, like what were you given anything, or was it just like, I don't know?
The doctor didn't even look at my chart other than
Uh,
all the symptoms I had checked off, and he said, "I'm writing you a prescription for Prozac.
oh
You
boy.
can't have all these symptoms." And that was his assessment, never having seen me before. The nurse had come in and taken my vitals. They didn't even see that I put at the top, "I think I had a stroke."
Oh my. So when you left that visit, were you like, maybe he's right, and or were you like, I know I'm right, and these no one's taking me seriously? Like, I can relate when you're going through something and, providers or whatnot are continuously telling you, like, oh, it's fine, but you kind of know inside that something's not right. You kind of start to question some. I know many people do, like, is it me? Like, is it me that's not comprehending this? But, what am I going to do type of thing. So where were you at after that visit?
So I was the type of person who hated to go to the doctors and put it off till the last possible minute. And I said to him, I don't think I need Prozac. And did you read the top of the list? I think I had a stroke. And then all hell broke loose in the ER, and I got sent for CAT scans and all kinds of blood work and testing. Came back, everything came back normal, which is why I think it was a series of TIAs and not a major event. They didn't do an MRI at that point, and no one tested for tick-borne illness. While I was sitting waiting to get released, uh, there was someone in the bay next to me behind the curtain, and he said, "Excuse me, I couldn't help but overhearing what you went through. I think you have Lyme disease."
Oh, wow. Thank goodness for this person.
Yeah, it was a painter, and he explained he had Lyme and what he had been through and the gaslighting that occurs. So I did eventually find a practitioner who tested, and I tested positive for Ehrlichia, Bartonella, and Lyme. But that practitioner got frustrated when I didn't get better after a few months of antibiotics. It wasn't until I found a functional medicine practitioner that I got any real help and went into my first remission. Over the years, struggling with the loss of work, the loss of income, the expense of paying out of pocket for some of the things that helped me, it was very frustrating. And particularly the bureaucracy of the government and healthcare and the stress that would come up from time to time with housing or family. All of those things really impact once you have an illness for that long and it goes chronic, it makes things worse. And
Sure.
so after 5 years of being relatively in remission, but still disabled, I got sick again. And I didn't realize it at the time. And it took years until around 2009, 2010 to realize that I wasn't going about things the right way. I wasn't doing enough for my mental health or as many things as I was doing for my physical health. And I had a lot of people calling me and asking me, "How did you get back to work?" I had formed a home business for myself. How do you cope with the gaslighting? And so my home business uh, didn't do well because I was answering all these questions. And I had had help from the Massachusetts Rehabilitation Commission to start this home business. I went back to them and said, "What can I do? I want to help these people. Do I go back to school and become a therapist? Is there some way to help these people?" And
Yeah.
I found a organization called the New England Business Associates that helped me formulate how to help people. And I had a wonderful person who said, "Why don't you form a nonprofit?" I had no money. I was on benefits, and
And you formed a nonprofit?
I formed a
That's
nonprofit.
amazing.
Um, Basically, the government was supporting it. The Social Security has this thing called a PASS plan, and it's a plan to achieve self-sufficiency. They promise that they protect your benefits while they're helping you establish yourself,
Oh, nice.
but it didn't work out that way. Every month, it was a challenge to keep all my benefits.
Oh, wow.
So it's impacted our organization over the years that we weren't able to have the growth that I projected originally. But again, it was experience, learning about the system, learning about the red tape that I could share with people. Oh, I think 2011, I went back to school for nonprofit management and got my certification. And then in 2013, the Lyme Center was founded and got its 501c3 status.
Very amazing. I mean, that's amazing that you were able to do that with all those challenges and barriers. I have reviewed your sites and so forth, and I see that one of your core messages is moving from victim to empowerment by being your own advocate. And I always love to stress that it's so important to be your own advocate. And what does self advocacy look like for someone that's newly diagnosed with Lyme disease?
It's important to cultivate enough self-confidence to ask questions. And if you're not capable to advocate for yourself, to have someone who can be with you at the visits, to ask important questions and help do research, because an educated patient is part of that self empowerment. And there's a lot of misinformation out there and controversy. it- Trying to find accurate, up to date information is challenging. And that's where we come in, that we can sift through all the static and help people find information that isn't leaning in any political direction, that it's backed up with real research.
I love that. And I know that is so needed because we do have many clients that come to us with Lyme disease or, don't really know what they have, and then they end up having Lyme disease. So, what about if somebody is outside of Massachusetts and they contact you? Do you have any resources that you can offer them, or, what happens in that scenario?
So if we don't have the resources, we
Mhm.
research. And
Wonderful.
we're a tiny organization and had not expected to expand across the United States, but because of the pandemic, we had to go all virtual. And it's led to patients in California, in the Midwest, Florida, from all over. And we're starting to get volunteers from other states as well. So it makes the research piece of it a lot easier when you have someone in the state that the help is needed.
Sure. No, 100%. If there's one thing that you want listeners living with Lyme disease or other tick-borne illnesses to hear today, what would it be?
There is hope to heal.
I love that. How do you think that your journey could have been lessened or, improved if this was available to you when you were going through this yourself? I mean, I know there's immense benefits, but like, how would you put it in your own words?
I felt like I was all alone. I tried different support groups, but there was no Lyme support groups. There was no real research being done other than what the CDC was promoting. And I had to do everything from scratch. And learning about going from a working individual to a disabled individual was devastating. And no one should have to do that alone.
No, I agree. And, I think with all these rare undiagnosed conditions, I think one similarity that I continue to see is that people feel isolated and alone as they're going through it because it is a very isolating experience. And I think without having this be the intention, the healthcare system has a way of isolating people when instead they should be helping them. And that's something that it's very multifactorial, in my opinion. I think it's lack of education, lack of proper logistics, lack of a lot of things. But in the end, the patients suffer and the outcomes are not what they should be many times. So I think your work is amazing. And I think it's even more amazing that you were able to create this out of, in a time that was most challenging for you.
I feel like this is part of my healing.
I love that.
And I encourage the volunteers to stick to their commitments. We try to be very flexible with our hours because when you're sick this way, you don't know, I'm going to wake up one day and be bedridden for the
Sure.
afternoon, or I did too much and I'm not feeling well today. And yet you look okay. And so to the outside world, the healthy individuals, they don't understand what the physical and mental impact is. So it's so important that you remember you're not alone, and you remember that there are these resources out there. There's national groups, Global Lyme Alliance, LymeDisease.org, but there's also smaller local groups too that I've watched such growth with the Lyme community of different types of support. And we're focused not on the politics, not on policy, but getting the resources to the people to help them move forward.
I love that. I really, really do. I think that's amazing. For those who are interested in learning more about your work or connecting with you, where can they find you?
They can find us at lymedrc.org, or they can call us 413-588-7388, or they can email us info@lymedrc.org.
That's great. So, Maria, I have to say thank you so much for your honesty, your advocacy, and the safe space that you've created for so many individuals that, like we mentioned, feel isolated and alone going through this process. Your work reminds us that patient advocacy is about more than medicine. It's about connections, empowerment, and humanity. And we'll definitely include the links that you've shared about the Lyme Disease Resource Center in our notes. And thank you again. Hope that this conversation, and I think it will, help our listeners feel more confident as they navigate the healthcare journey. Thank you so much. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.